My name is Jeff. I'm 59 years young. I live near Tampa, Florida. I have 2 beautiful children. My fiance, Sherry, has 2 of her own children, and her son has 2 daughters. And so I'm a built-in immediate grandpa, and I really love that because we spend a lot of time with them. They come down and visit. I first started noticing something was wrong when I was excited to have Sherry meet my family up in Hartford, Connecticut. So, you know, we jumped on a plane and we were really excited, and we got on a plane and my thighs started kind of itching, like fiery, hot. I was trying to scratch them through my thick jeans. So I was really struggling on the flight. And by the time we landed and I got to my sister's home, you know, I took my jeans down and my thighs were like 90% covered with welts, and they were actually bleeding because I was scratching so hard. So the next morning we got up, my sister and Sherry took me to a walk-in clinic. Upon the doctor, you know, evaluating my skin, he gave me a dose of steroid and sent me home with a pack of steroid, which kind of helped me get through the vacation time. I went through 2 or 3 dermatologists, and with each one lasting about 1.5 years, we tried different creams, different pills, injections, anything to try to get some relief. The last one, he had a friend that was an immunologist. He thought that it would be beneficial for him to take a second look at my skin to see what the next step would be. I called to make an appointment, and the secretary at her front, she went down the hall and she spoke to the physician, and he said, well, have him send me pictures of the worst part of the body to my personal email. So, of course, I went in the bathroom and took the worst spots that I could find. There were plenty of those. And I sent him those email pictures, and that was in the afternoon. And later that evening, he called me back live on the phone. Then he said, get to a cancer center. And that hit hard. So upon arriving at the cancer center, they sent me up to the cancer skin clinic. After the dermatologist evaluated my whole body surface, she decided she wanted to get 3 biopsies immediately. When I went in the next day, I went in the examining room, and this cancer doctor, the hematologist, came in and he said that he reviewed the work, and that indeed it was CTCL, cutaneous T-cell lymphoma. And he went a little bit further and said it was kind of a subgroup called Mycosis Fungoides, and all the names, and you know, my head was kind of spinning. And I thought, man, at one point, like, I can't have this. You know, I was kind of in denial. But as my head was spinning, he kind of calmed me down a little bit and said, you know, you're in the right place, and we're gonna help you. After failing several treatments, my doctor felt it was time to bring up to me POTELIGEO as a treatment option. He pulled out the information, and we went over the risks and benefits of the treatment, and we decided it's best for me to get started. Once we got it approved, we started right away. The first 5 weeks, it was once a week, a 60-minute infusion, and then at week 6, we went to the every other week. Over time, as I was getting the treatment, my lesions and rashes started to dissipate, and I felt really good about it. I just generally was getting better, and I was happy the way the treatment was going. Occasionally, I get a few patches on my skin, but we put some steroid cream on it, and that seems to help. The day I get my infusion, like that evening, I probably go to bed a little bit earlier. I get like a tiredness, and I sleep a little bit longer. Of course, this is my experience, and it could be different for other people. The last few years for me have probably been the worst that I've ever experienced. I got COVID, Sherry, my fiance, got COVID. Then shortly after that, I lost my job to COVID, and then dealing with this cancer, and it was just a lot. And I think with a lot of determination, we were able to overcome all those and come out at the other end. So we're spending a lot of time with the grandkids, and my son and daughter come and visit a lot. So really it's changed our whole life, the dynamics, as we move forward. The biggest lesson I've learned through these 3.5 years is never give up. You know, look for that next positive step, whether it's treatment or talking to a specialist or whatever that next step is. Keep the steps going, because it'll be brighter on the other end.
POTELIGEO is a prescription medicine used to treat Mycosis Fungoides, MF, or Sézary syndrome, SS, in adults who have tried at least 1 prior medicine taken by mouth or injection that did not work, or in whom the disease has come back. POTELIGEO may cause serious side effects that can be severe or life-threatening, including skin problems, infusion reactions, infections, autoimmune problems, and complications from stem cell transplant. Call or see your healthcare provider right away if you develop any symptoms of the following problems or if these symptoms get worse. Skin problems. Signs and symptoms of skin reactions may include skin pain, itching, skin blistering or peeling, rash, painful sores or ulcers in your mouth, nose, throat, or genital area. Infusion reactions. Signs and symptoms of infusion reactions may include chills or shaking, redness on your face, flushing, itching or rash, shortness of breath, coughing or wheezing, dizziness, feeling like passing out, tiredness, fever. Infections. Signs and symptoms of infection may include fever, sweats or chills, nausea, flu-like symptoms, sore throat or difficulty swallowing, shortness of breath, diarrhea or stomach pain, cough. Autoimmune problems. Some people receiving POTELIGEO may develop autoimmune problems, and some people who already have an autoimmune disease may get worse during treatment with POTELIGEO. Complications of stem cell transplant. Patients who receive a stem cell transplant using donor stem cells, allogeneic, after treatment with POTELIGEO may experience complications that can be severe and lead to death. Your healthcare provider will monitor you for signs of complications if you have an allogeneic stem cell transplant. The most common side effects of POTELIGEO include rash, tiredness, diarrhea, muscle and bone pain, and upper respiratory tract infection. Before starting POTELIGEO treatment, tell your doctor about all your medical conditions, including whether you have had a severe skin reaction after receiving POTELIGEO, have had an infusion reaction during or after receiving POTELIGEO, have or have had liver problems including hepatitis B, HBV infection, have a history of autoimmune problems, have undergone or plan to have a stem cell transplant using cells from a donor, have lung or breathing problems, are pregnant or plan to become pregnant. It is not known if POTELIGEO will harm your unborn baby, are breastfeeding or plan to breastfeed. Talk to your healthcare provider about the best way to feed your baby during treatment with POTELIGEO. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. You are encouraged to report suspected adverse reactions to Kyowa Kirin Inc. at 1-844-768-3544 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.